Welcome to Review Central. This is NCLEX Reviewer number 7, featuring questions on reduction of risk potential. This reviewer is intended for those who are eyeing, or are set to take either the NCLEX-PN or the NCLEX-RN. There are 10 questions featured on this reviewer. All questions are modeled on actual questions that appeared on previous NCLEX exams. Now let's begin. Question number 1. Which of the following electrolyte changes may exacerbate digoxin toxicity? A. Hypercalcemia. B. Hypocalcemia. C. Hyponatremia. D. Hypokalemia. The correct answer is D. Hypokalemia. Hypokalemia and hypomagnesemia commonly worsen digoxin toxicity. Patients taking digoxin frequently also take loop diuretics for the management of congestive heart failure. Loop diuretics commonly cause electrolyte disturbances. A bolus dosing of intravenous calcium has been thought to cause stone heart syndrome. The incidence of this is unclear, and generalized hypercalcemia is not known to cause this complication. Hyperkalemia is seen in severe acute digoxin toxicity, and a potassium greater than 5 milliequivalents per liter is an indication for digoxin-specific Fab fragments. Hypokalemia, on the other hand, can potentiate digoxin toxicity by promoting cardiac arrhythmias. Question number 2. What is the correct medication dose to be given at 5 mg per meter squared for a child with a body surface area of 1.14 meters squared? A. 1 mg. B. 4 mg. C. 5.7 mg. D. 10 mg. The correct answer is C. 5.7 mg. 5 mg per square meter times 1.14 square meter equals 5.7 mg total dose. Question number 3. What is the most appropriate initial treatment regimen in a patient with disseminated intravascular coagulation secondary to bacterial sepsis? A. Broad-spectrum antibiotics. B. Immediate platelet transfusion. C. Surgical exploration. D. Immediate packed red blood cell transfusion. The correct answer is A. Broad-spectrum antibiotics. The best initial treatment of disseminated intravascular coagulation or DIC involves addressing the underlying problem. In this scenario, broad-spectrum antibiotics are warranted. Patients with DIC who are not actively bleeding should receive prophylactic anticoagulation with heparin or below molecular weight heparin or LMWH. Platelet transfusions may become necessary for DIC patients, particularly in those actively hemorrhaging with a platelet count of fewer than 50,000 platelets per microliter. Fresh frozen plasma also may be considered in these patients to replenish coagulation factors. Question number 4. How frequently should an adult patient with diabetes mellitus examine his or her feet? A. Yearly. B. Monthly. C. Weekly. D. Daily. The correct answer is D. Daily. Patients with diabetes mellitus should examine their feet daily. Foot ulcers secondary to diabetes mellitus are common and associated with morbidity and mortality. Loss of protective sensation can render patients unable to recognize damage to their lower extremities. Consistent daily foot examination and care can reduce amputations among patients with diabetes mellitus. Question number 5. Which of the following does not increase the risk of tuberculosis? A. HIV/AIDS. B. Pneumonia. C. Lymphoma. D. Chronic renal failure or CRF. The correct answer is B. Pneumonia does not increase the risk of tuberculosis. Hematologic malignancies such as lymphoma and leukemia increase the risk of tuberculosis. Other factors increasing the risk are chronic renal failure, HIV/AIDS, jejunal bypass, gastrectomy, diabetes mellitus, and silicosis. Immunosuppressive therapy and weight that is less than 10% below ideal weight also increase risk. Question number 6. A 57-year-old woman presents to her primary care physician for an annual physical exam. She reports feeling more tired than usual and has reduced exercise tolerance over the past few months. The physical exam shows her blood pressure is 100/60, pulse is 80 per minute, and respiratory rate is 12 per minute. Blood lab results include sodium ion is 130 milliequivalent per liter, chloride is 95 milliequivalent per liter, potassium ion is 6.0 milliequivalent per liter. Which of the following is most likely to show within her electrocardiography results? A. T-wave anomaly. B. Absent P waves. C. Wide complex QRS. D. Prolonged PR interval. The correct answer is A. T-wave anomaly. The P wave represents the contraction of atrium. The T wave is ventricular repolarization. Repolarization is dependent upon potassium ion. Modest hyper and hypokalemia are associated with ventricular repolarization anomalies. Severe electrolyte imbalances can potentially alter most every aspect of cardiac electrophysiology. Question number 7. What is the best course of management for a patient who presents with chest pain and blood pressure of 160/110 mm of mercury in the right arm and 113/70 mm of mercury in the left arm? A. ECG, troponin. B. Sublingual nitroglycerin, ECG. C. Heparin bolus, Doppler ultrasound. D. Nitroprusside followed by CT. The correct answer is D. Nitroprusside followed by CT. Chest pain with blood pressure disparity of upper extremities is highly suggestive of thoracic aortic dissection. Any patient presenting with chest pain should have manual blood pressures obtained in both arms for comparison and documentation. Palpate and record radial pulses bilaterally and monitor for discrepancies. Management includes rapid reduction of blood pressure with nitroprusside or nicardipine hydrochloride and beta blockers. Beta blockers are used to reduce arterial delta pressure per delta time. Initially, therapeutic goals include pain control and blood pressure reduction. Systolic blood pressure of 100 to 120 mm of mercury is ideal or as low as the patient can tolerate and maintain perfusion of vital organs. Specific MAP parameters set by the provider for optimal management of the emergent condition should be followed. Pain control with morphine may be warranted to guard against tachycardia and hypertension. Controlling blood pressure and heart rate will require a multifaceted approach to constantly evaluate and reevaluate the treatment regimen for reducing aortic pressure, delaying rupture, and ensuring a positive outcome. Question number 8. Which of the following conditions is least responsive to electroconvulsive therapy or ECT? A. Bipolar disorder. B. Parkinson disease. C. Chronic schizophrenia. D. Major depressive disorder. The correct answer is C. Chronic schizophrenia. Acute symptoms of schizophrenia may respond to electroconvulsive therapy or ECT, but it is not useful for the treatment of chronic schizophrenia. Established indications for ECT include major depressive disorder, mania, and catatonia. Other conditions for which ECT has been used with less evidence include Parkinson disease, intractable epilepsy, and neuroleptic malignant syndrome. Question number 9. Which of the following locations may have an association with victims of sex trafficking? A. Brothels, strip clubs, and bars. B. Hotel, motel, or street-based. C. Truck stops. D. All are correct. The correct answer is D. All of the above locations may have association with victims of sex trafficking. Sex trafficking can be hotel or motel-based, street-based, or in residences functioning as brothels. Commercial front brothels, escort services, truck stops, bars, and strip clubs can be places where sex trafficking occurs. Sex trafficking can happen at home with parents, intimate partners, or other family members being the perpetrators. Victims may not see themselves as a victim and may refer to the trafficker as their daddy or boyfriend. According to the Trafficking Victims Protection Act or TVPA, sex trafficking is the recruitment, harboring, transportation, provision, obtaining, patronizing, or soliciting of a person for the purposes of a commercial sex act, in which the commercial sex act is induced by force, fraud, or coercion, or in which the person induced to perform such an act has not attained 18 years of age. Question number 10. Which of the following is a normal total serum calcium? A. 5 mg per deciliter. B. 9 mg per deciliter. C. 14 mg per deciliter. D. 24 mg per deciliter. The correct answer is B. 9 mg per deciliter. Normal total serum calcium is between 8 to 10 mg per deciliter. Ionized serum calcium is sometimes considered a bit more accurate and reliable, but for most purposes the total calcium is sufficient. Borderline hypercalcemia or very mild elevations may still be clinically significant if associated with high or high normal parathyroid hormone levels. Parathyroid hormone, vitamin D levels, and calcitonin together control blood calcium levels. You have just completed NCLEX Reviewer number 7, which featured questions on reduction of risk potential. If you wish to watch more NCLEX reviewers on reduction of risk potential, check out our NCLEX Reduction of Risk Potential Reviewers playlist. Check out also our other NCLEX playlists for other reviewer topics. If you haven't done so yet, please don't forget to subscribe to Review Central and click or press the bell button to make sure you get notified whenever we post a new reviewer or other review materials on this channel. Please like if you find this video useful and feel free to share to anyone who may also benefit from it. We wish you all the best on your forthcoming NCLEX.